All right, let's talk about something that, let's be honest, affects a ton of us, but is just loaded with myths and confusion: constipation. So today, in this explainer, we're going to cut through all that noise and get straight to the facts, using a clear, evidence-based approach to figure this all out.
So, let's just jump right in with the big one, right? The question everyone has. How often should you really be going? I'm willing to bet the answer is going to surprise you.
And boom, myth busted right out of the gate. That idea that you absolutely have to go every single day? Yeah, that's just not true. The clinical evidence shows this incredibly wide range of what's considered normal. We're talking anywhere from 3 times a day to, get this, just 3 times a week, all totally normal for an adult.
Okay, so if normal is that flexible, then what is constipation really? What are we actually talking about? Let's get into the official definition to build on that.
And this is where it gets really interesting. See, it's not just about how often you go. The real definition is a combo deal. It's going fewer than 3 times a week and having to deal with other stuff, like straining, having really hard stools, or that super frustrating feeling like you're not quite done. Right, and this isn't just about having a bad week or two. For a doctor to call it chronic constipation, there are specific guidelines. They're called the Rome 4 criteria, and they say these symptoms have to be sticking around for at least 3 months.
Okay, now this might look a little funny, but it is an incredibly useful tool. It's called the Bristol Stool Form Scale. It's basically a visual guide, no more awkward descriptions needed. You just look at the chart. Types 1 and 2, that's what we'd call constipation. Types 3 and 4, that's the ideal zone. It's a really simple, straightforward way to know what's going on.
All right, so now we know what it is, but the big question is, why does it happen? Think of constipation not as the main event, but more like a symptom, a clue. So let's put on our detective hats and go look for the usual suspects. When you break it down, the causes usually fall into one of 3 big buckets. First, there's our lifestyle and what we eat. Second, you've got side effects from some really common medications. And third, sometimes it can be a sign of an underlying health issue.
And this part is a real eye-opener for a lot of people. I mean, look at this list. We're talking about super common over-the-counter stuff. Your allergy meds, painkillers like ibuprofen, even your daily iron or calcium supplements. It just goes to show you have to look at the whole picture.
So beyond just meds, there are other things that can increase your risk, like getting older or not moving around enough. But what I find fascinating are the behavioral things, like constantly ignoring that gotta-go feeling, or even just traveling and getting your whole routine out of whack. That can be enough to mess everything up.
Okay, so knowing the causes is great, but what can we actually do about it? Let's flip the script and talk about being proactive. Because when it comes to this, prevention is absolutely the best medicine.
Your number 1 tool in the prevention toolkit? Fiber. The official recommendation is somewhere between 25 and 38 grams a day for adults. But here's the kicker. Almost nobody actually gets that much. So it's a simple number, but think of it as a powerful new goal.
But, and this is so important, not all fiber is created equal. You've got 2 main types. Soluble fiber, think of things like psyllium. It forms this gel in your gut and helps keep things soft. Then you've got insoluble fiber, like wheat bran, which is more like a scrub brush, kind of pushing things through. And here's the wild part. For some people, too much of that scrub brush stuff can actually make constipation worse. It's all about finding the right balance for you. So here it is, the prevention playbook. It's pretty straightforward. First, you've got your inputs. Drink plenty of water, at least 1.5 liters a day, and get some movement in. Next, it's about your habits. Set up a regular, unrushed bathroom routine and listen to your body. When you gotta go, go. And finally, a little life hack. Using a small footstool, it actually puts your body in a much better, more natural position for, well,
But what happens when you've done all that and you're still struggling? Let's take a look at how doctors think about treatment. It's not just a guessing game or about grabbing the first thing you see at the pharmacy. There's a really logical, step-by-step process they follow.
They call it the management ladder, and it makes perfect sense. You always start on the first rung. That's all the lifestyle and fiber stuff we just talked about.
If that's not cutting it after, say, 4 to 6 weeks, you climb to the next rung, adding something called an osmotic laxative. Then, way up the ladder, you have stimulant laxatives, but those are really meant for short-term rescue situations. And the very top rung? That's for tougher cases that might need newer drugs or even a specialist.
And a big reason for that latter approach is all about timing, how fast these things work. You need quick relief? A suppository can work in like 15 to 30 minutes. Bam. But for long-term management, you want something gentler. That's where osmotic or bulk-forming agents come in. They take a day, maybe 3 to work. It's all about using the right tool for the right timeline.
So how do they work? Well, they're totally different. Bulk-forming laxatives are pretty gentle. They just add more water and, well, bulk to the stool. Stimulant laxatives are more direct. They actually make the intestinal muscles contract to push things along. Again, different tools for different jobs, and yeah, they each have their own possible side effects, like gas or cramping.
Okay, everybody, lean in for this part, because this is probably the most important thing we're going to cover. Look, most of the time, this is something you can manage yourself. But there are some definite red flags, some signs that mean you need to stop guessing and go see a doctor. And these are them. These are the red flags. You absolutely cannot ignore these. If you've been constipated for more than 2 weeks, even after trying stuff, if you're losing weight and you don't know why, if you see blood, if there's severe pain or a fever, you have to go see a doctor. It's crucial to make sure nothing more serious is going on.
And before we finish, I want to leave you with this one last thought. Based on a pretty telling statistic, it seems about 4% of people using laxatives might be overdoing it. And what happens is they get caught in this vicious cycle, this pendulum, swinging from constipation to diarrhea and back again without ever really fixing the underlying problem.
And that really brings us to the final, most important question you can ask yourself. When we're looking for relief, are we actually trying to treat the cause, or are we just constantly searching for the next quick fix? How you answer that? Well, that's the key to figuring out your long-term gut health for good.